Did you know that a hidden gut issue could be triggering your autoimmune disease? In today's video, we're uncovering a major root cause of autoimmune disease, intestinal permeability, also known as leaky gut. I'll break down what it is, how it triggers autoimmune disease, what causes it, and what you can do to try to help repair your gut. Autoimmune disease affects 23 million people worldwide. And although there are medications out there, only 50% of those people will achieve remission by 5 years. That means that half of that 23 million are still suffering with the symptoms of autoimmune disease. The other issue is the medications can hit a plateau and will stop working. So many people will have to switch medicines to control their symptoms after several years. From a functional medicine standpoint, one of the most common causes of autoimmune disease is intestinal permeability. What is intestinal permeability? Your gut is basically a one-cell barrier from what you eat from the outside world to what goes into the bloodstream. These cells will have tight junction between them. The spaces between each of those cells is very tight, so nothing can get through between the cells. When you are digesting and you're absorbing well, you are absorbing your micronutrients, vitamins and minerals, which are small molecules that can get through the cell. Now, occasionally these tight junctions may open up briefly, but they close right back up again. However, there are conditions that can happen that cause these tight junctions to stay open. And when they do, bacteria, viruses, toxins, and even undigested food can get through these open, tight junctions into the bloodstream. And then what happens is it triggers an immune reaction. Your body naturally wants to protect itself. When it senses this bacteria, virus, toxin, or undigested food, it senses it as foreign. So it makes an antibody to it and attacks it to try to keep it from harming you. However, there is a process called molecular mimicry. Molecular mimicry means that there is a protein in a foreign invader that may look chemically similar to a protein in our cells, tissue, or organs. So what happens is when your body is attacking that foreign invader, but it has a protein that looks similar to your cells, tissues, or organs, it'll attack it too because it thinks it's part of this foreign invader. For example, people with Hashimoto's thyroiditis tend to do well when they go on a gluten-free diet. The reason is there is a protein in gluten that looks very similar to the protein on the thyroid gland. So if they have a food sensitivity to gluten, when they eat that, they're triggering an antibody that will also attack the protein in their thyroid gland in addition to the gluten because it thinks it's foreign. So one strategy for Hashimoto's is to go on a gluten-free diet and people can feel better. I have several patients that have done that and they've been able to actually avoid going on thyroid medication because their numbers tend to stabilize when they're avoiding gluten. It's even getting on board with conventional medicine because I've noticed many of the endocrinologists now are also recommending that. What causes leaky gut? Usually when you have autoimmune disease, it's not something that happens right away. It's usually been a process that has slow built over the years because of certain triggers that are causing gut issues and leading to intestinal permeability. So one of the main causes is stress. Stress can cause chronic inflammation in your gut, and whenever you have inflammation, that is going to increase the likelihood of intestinal permeability. It also affects your gut microbiome, and when your gut microbiome is off, you also have increased inflammation, and so that will also cause intestinal permeability. Diet is a huge one, and probably the one that can make the biggest difference if you change it. A diet that is high in processed foods, so foods that are high in sugar, refined flours, seed oils, those all cause a lot of inflammation. They can damage the gut lining and cause that intestinal permeability. Certain medications like NSAIDs can damage the gut lining. They also can affect digestion because they may affect the stomach acid. If you're not digesting your foods well, then that can increase your risk for food sensitivities and increase the risk for imbalance in your gut microbiome and inflammation. And toxins from our environment, whether that be pesticides in our foods, heavy metals in our foods, or dental fillings or joint replacements, or from our personal care products. So you want to make sure that you try to minimize toxin exposure so that you don't get damage to your gut. So how do you know if you have leaky gut or intestinal permeability? What are the symptoms? Well, if you have any GI symptoms such as bloating, gas, constipation, or diarrhea, then there's a chance that you may have a leaky gut. If you have any food sensitivities, that tends to mean that you have intestinal permeability. If you have brain fog or mood changes, and problems such as eczema or psoriasis, and joint inflammation or pain. So how do you go about healing your gut so you can reduce the inflammation and also possibly make it more likely to go into remission from your autoimmune disease? Well, in functional medicine, we have something called the 5R approach to gut health. So the first R stands for we want to remove anything that could be triggering to the gut. These can be food sensitivity. If you do have a gluten or dairy sensitivity or other food sensitivity, you want to work with your functional medicine care provider to do an elimination diet with a slow reintroduction. I would probably recommend doing it for about 4 to 6 weeks, but work with your functional medicine provider. Some people may need a longer span. We also want to remove any infections. A lot of times we will do a stool test and I will find infections on there that I did not find on conventional stool testing, because conventional stool testing only checks for the food poisoning bugs like Salmonella, Shigella, E. coli, and Campylobacter, but there are a lot of other pathogenic bacteria that can be in your GI tract that may be missed on these standard stool tests. Some people will have a candida infection that needs to be treated. You also want to remove stress, because stress can cause inflammation. You want to remove those environmental toxins from your food, water, and personal care products. The second R is to replace. A lot of people with gut health issues will have an issue where they're not producing enough digestive enzymes. You also want to make sure you chew your food really well, because if you swallow your food and it's not completely chewed, then your body has to work harder to digest that down into smaller components. If you are lacking digestive enzymes and you're not chewing properly, that's going to even further exacerbate the problem. So one simple thing you can do to improve the digestion is to chew your food well. There is a stool test called pancreatic elastase that can judge if you are low in digestive enzymes from the pancreas. Your pancreas makes digestive enzymes that digest your fats, your carbs, and your proteins. Your liver makes bile that helps digest your fats, and it's stored in the gallbladder. So if you've had your gallbladder removed, then you may be at higher likelihood to have less bile acids and may have trouble digesting your fats. From your stomach, you have stomach acid that helps digest your proteins. The third thing we do, the third R, is repopulate. We want to repopulate or reinoculate our gut microbiome, which is in our large intestine. So you want to make sure you work with your functional medicine provider to come up with which type of probiotics might be best for you. In general, Lactobacillus rhamnosus is a good one. Lactobacillus plantarum and Saccharomyces boulardii are great probiotics to help balance your gut. However, again, it can vary depending on what health conditions you have. So you want to work with your healthcare provider to see which probiotic is optimal for you. You also need prebiotics to feed those probiotics, so you want to make sure you're getting plenty of prebiotic foods. The fourth R is repair. You want to repair that gut lining and heal that intestinal permeability. Common supplements to do that are L-glutamine, zinc carnosine, aloe vera, collagen, and bone broth. The last R is rebalance. You want to rebalance and make sure that you have stress management techniques in place. You want to make sure that you are optimizing sleep. There are several strategies you can do to get better sleep, such as not eating 2 to 3 hours before bedtime, no work 2 hours before bedtime, and definitely no devices 1 hour before, as these can disrupt your circadian rhythm and can even affect the quality of sleep. I hope this video was helpful and gave you some strategies to use in addition to your medications. Now, as a reminder, do not stop your medication because you don't want to have any rebound symptoms, and the medications are important to calm the acute symptoms of autoimmune disease, because when you do have acute symptoms, they can destroy your joints and your tissues and organs. So You want to make sure if you are on a medication that you stay on it, but you can work with your functional medicine provider and your rheumatologist to do some of these strategies to heal your gut. Try some of these supplements that may help. There also are supplements for pain that your functional medicine provider can recommend, and they can watch you closely, and then as you're healing, then your rheumatologist may be able to wean the spacing of your med or wean down the dose, and then hopefully eventually get you off where you can be in that 50% where you can be in remission. If you like this video, please subscribe. Please like and share if you found it helpful, and leave other topics that you would like me to talk about. Have a fantastic day.